As soon as a doctor who is registered for this software logins to this website, this is the index page or dashboard. And once you click on health and EMR, electronic medical record option, this page will come where you can register new patient, any new patient here, and all the registered patient, new patient who is not discharged will come below. And in registration, only name, gender, date of birth, mobile and email ID is asked. But the email, ID, mobile and name is not essential. Gender and sex is enough. So once you click on the EMR button of the current EMR which is made for this particular patient will be shown here. And you can go to the symptom. You can see what are the symptoms of these patients, and you can enter new symptoms, and these are the headings under which you have to just click. And previous symptoms like bleeding nose, you can edit previous symptoms. If something is not entered properly, you can change those findings or history. And once you edit it, and you can add another symptom from here, or you can submit for auto diagnosis. Means there are few symptoms for which auto diagnosis is made. The history will be taken automatically. Just suppose a headache is entered, and once you click submit, so the computer will ask a series of questions based on patient's gender and age, and as each question is being answered, which is also in Hindi, so that it can be done by a health worker also from anywhere, even at the doorstep. And once this history is taken, all the questions which is coming is relevant to this particular case. As the answer is being given, the diagnosis is being made in the background, and depending on that possible diagnosis, the next question is also being asked. So the history may continue for long, 5 minutes, or it may be finishing in 1 minute, because if the diagnosis is very clear of a particular thing, the question will not be asked further and diagnosis will be shown. So these are the possibilities. And in this particular case, migraine is or tension headache is being suspected, so the corresponding question is being asked, and the frequency of headache, how frequently does this pain occur, and these are the things. Well, you can select the particular option, and here one video or audio can also be inserted depending on the patient's choice, and they can listen or they can see the doctors and who will be asking the question. And once you select all these parameters and submit it, then after the question is over, depending on the suspected diagnosis, the series of questions is coming. And in this particular case, tension headache is being suspected, so this question is being asked whether there is neck stiffness or not. And so once you submit it, once the last question comes, there is some delay, and see the list is over and possible diagnosis is coming. First is tension headache, that number is 1280, and second is so you can see the diagnosis below, and the number like intracranial neoplasm only 710. So the number is also given so that you can see the relative possibility of any particular diagnosis. So the diagnosis which is below is has less probability. This is the mobile view of that particular thing. That was a laptop view, and one can see the same thing in mobile. And people can go to the doorstep, take the history, and show to the patients the possibilities that can happen. The no treatment is being advised here, only the possibilities and why you are suffering from the headache and what are the possibilities that needs to be considered. So like this headache, we have made this auto diagnosis in many other symptoms also, and we are fast adding to those symptoms. And this is the sign. You can add new sign, you can detail of the signs you can enter, and then you can click the radiology, you can enter the radiology name, you can enter the report summary, and suppose in this case, this particular CT scan, this is the report summary. You can edit this particular diagnostic this thing, and you can change the report summary, or you can add another image. So you can add the corresponding representative image in this website, so that whole list of CT scan MRI is not entered, only the relevant images can be uploaded. Now treatment, see these are the current treatments being given to these patients, and suppose one want to add to the symptoms, and you click on the drug, and the list of all the drug, antiviral, anti-dementia, antiemetic, all this list of groups of drug is given. And once you click on particular medicine, suppose anticonvulsant, C drugs, and these are the drugs which is available as anticonvulsant. And suppose you want to give levetiracetam, so you can see the drug detail, and you can see the mode of action, indications, dose, prescriptions. So you can see from this what are the side effects, all this you see, and then prescribe this particular drug, and then that drug will be added to this here. Suppose you want to change the prescriptions, you can change the dose of this particular drug for this patient. You can change it here and write the appropriate dose for this patients. And once you edit it, the changed prescription will be updated here, and suppose 5 minute injection, 12 hours enter. So these are the treatment which can be updated. Suppose all this will be changing the reports. These are the reports of the case report is generated automatically, or this is a discharge summary. This can be done for IPD, OPD. You can take the prints out. And suppose now you want to, for surgeons, if you are doing some procedure, so procedure once entered for one time, it can be remembered by the software. Suppose I have done decompressive craniectomy for this patient, just for example, and I submit this. The detail of the operation is automatically loaded from the previous operations. If you need any editing this thing, you can edit it, or you can just add to the procedure, and hold operation note is written within seconds. You don't need to write it again and again for the same procedure if the operation is same. And this report is generated, and operation note is written here. So you can see operation note is written here. And once you press Control P, the printout can be taken of this. This is 2-page summary. You don't have to write this history and the operation note, and automatically the computer will generate for you, and that can be printed and added to the file. So the electronic report is also there, which can be retrieved anytime, anywhere, and the printouts or hard copy can also be generated. Patient is being discharged. Once you discharge the patient, you have to enter the outcome. How was the outcome for this patient, and what is the type of discharge? And you can write in discharge comments or any further advice. And this is the feedback page by which the patients can give feedback to the patient. Patient can also see their records. They cannot edit it. They can see the record, and they can submit what are they suffering from. They can enter their voice, and they can submit their particular status, and doctors can see their patient's feedback and give appropriate advice later on. So this is the software by which we can manage our patients well. We can give transparent treatment. We can see the patients, many patients who are admitted in our hospital, either in the OPD, current treatment going on, or in the IPD, and we can create a discharge summary, we can create operation notes, everything. And this overall will be an excellent tool for doing research about various outcomes of any diseases, the treatment given, and the outcomes. So there are many possibilities of many researches from this accumulating database, and we can share our treatment record with other doctors. They can give opinion to our patients, and we can discuss our cases, and we can get to new treatment guidelines, especially from doctors who are giving good outcome to a particular diagnosis. They can share their patient's record to the doctors who are treating the same patients anywhere, and thus we can help each other in improving the patient's outcome. So whoever who wants to use this software can email me, and you can go to the website healthyhappylife.org, healthyhappylife.org. You can register there, and once we approve the doctor's profile, they can also use this software from anywhere. Thank you.